He was a dedicated doctor, a crusader,
There's sick people that need to be made well.
battling to heal a destructive disease.
We've got kids dying, and we need to do something, and we've got something that works.
But for some patients, was the treatment just too dangerous?
He said it was going to be the first day of the rest of his life, and it was the last.
Dr. Bob Arnott asks, in a doctor's zeal to help his patients, was he blind to the risks? From our studios in Rockefeller Center, here is Jane Pauley.
Tonight, a man with a mission, a doctor determined to heal a destructive, too often fatal disease, to help those who might otherwise have little hope of ever living a normal life. But instead of testimonials to a great humanitarian, he's on trial. See what you think. In his missionary zeal, did he risk the very lives he was devoted to saving? Here's Chief Medical Correspondent Dr. Bob Arnott.
Please welcome Dr. Guberman to the show.
He was the star of the TV talk show circuit. 2 years ago, you couldn't miss him.
This gives the drug addict a chance to live clean and make the decision with a clean mind.
The media called him Dr. Detox, a crusader and advocate for a cutting-edge treatment he says was the answer to one of society's most vexing problems.
Dr. Lance Guberman is talking about heroin addiction. But before you reach for that remote control, hear this. According to the latest estimates, there are 1.5 million Americans who are addicted to heroin, and that number is growing. And heroin addicts are not just those people who may have stolen your car radio or that you may see lying in alleyways like this one in our inner cities. Today they could be almost anyone. Lawyers, business executives, surgeons. That heroin addict could be your neighbor, your doctor, even your son or daughter's high school classmate.
They're not bad people that need to be made good. They're sick people that need to be made well. And this is something that does it.
That something is a technique called rapid opiate detoxification, practiced by Dr. Guberman and a handful of other doctors around the country. It's called rapid detox because that's the chief difference between it and quitting cold turkey or traditional detox at a hospital or rehab center. In those cases, the physical symptoms of withdrawal can last up to 7 days and are so agonizing that most addicts fear withdrawal more than they're continuing to use a drug they know could kill them. Rapid detox takes just hours and offers a way around the pain.
It's only going to seem like a couple minutes, and then you'll be up again and you'll be clean.
Dr. Guberman says he eliminates most of the pain of withdrawal simply by putting his patients to sleep. Here's how he does it. The patient is anesthetized. Then Dr. Guberman administers a cocktail of medicines including naltrexone and Narcan. These drugs are known as opiate antagonists. They're stronger than heroin and are able, in effect, to force it off the cells in the patient's brain. When that happens, the usual severe withdrawal symptoms set in. Only now the patient is unconscious and unaware of them. What would normally take 4 to 5 days is accomplished in 4 to 5 hours.
All right, everything went well. You're doing good.
After a patient has completed rapid detox and they wake up, where are they?
I've saved them the first 2/3 to 3/4 of their withdrawal. They still have to finish it out, but they're over the hump.
After the treatment, says Dr. Guberman, addicts can concentrate on the all-important psychological rehabilitation instead of worrying about where to get their next shot of heroin. And the doctor offers something else to guarantee patients won't go back to using heroin right after the treatment. He implants a naltrexone pellet that he claims blocks the effect of the drug for up to 60 days and discourages the addict from shooting up again.
Safe. Rapid detox gets you there, and the other methods don't. Or if they do, they don't very well, they don't very often, whereas we got a method of detoxification that gets you at least to start 100% of the time.
Some in the medical establishment don't necessarily think so. In 1996, several addiction experts argued to the National Institute of Drug Abuse that more research needed to be done about rapid detoxification and questioned its safety, saying it lacked ethical, medical, scientific, or financial justification.
I mean, you can continue doing research forever, but right now we're in the middle of an epidemic here. We've got kids dying, and we need to do something, and we've got something that works. Let's do it.
To Dr. Guberman, it's a battle, and one of the enemies is time. In his view, the longer an addict is on the street untreated, the greater the chance of his dying from an overdose.
You're all clean. All the drugs are out of you.
Coming in, get ready with Narcan pump.
Usually, as in this rapid detox program managed by Ultramed and New Jersey's Pascack Valley Hospital, drug addicts undergo rigorous physical and psychiatric exams that can last up to 2 weeks before they're allowed to undergo the procedure. And afterwards, they're left in the hospital for at least 1 day under professional supervision. In 2 years, they've treated 44 patients, 38 of whom are still clean. That's an enormous success by today's drug rehabilitation standards. But these limited numbers of patients were not good enough for Dr. Guberman. He decided to make rapid detox even more rapid.
I realized that if I had the equipment and the personnel, everything the same as I had in the hospital, there was no reason why I couldn't do it here in the office, and I could do it at a much cheaper price so that it would be available to more people.
It was the first rapid detox outpatient facility in the country. Now an addict could physically kick the habit in as little as half a day and do it for a little less than $3,000, about half of what a hospital-based rapid detox charged, and in many cases, cheaper than conventional detox. Important because rapid detox is not yet covered by insurance companies. Many of Dr. Guberman's patients see him as a savior.
How many of you tried to quit with traditional detox? And how many of you failed to quit with traditional detox? If there were no Dr. Guberman, where would you be today?
I don't even want to venture to even think about it, to tell you the truth.
Pretty sure I'd be dead.
I'd be dead.
Thousands of heroin addicts believe the same thing. Demand for his form of rapid detox was so high, Dr. Guberman had to hire another doctor to assist him. By 1999, they had detoxed over 2,000 addicts, many of whom, says Dr. Guberman, went on to beat their addiction.
Okay, Amanda and Damien.
Watch Dr. Guberman with his patients and you see a special bond, an uncanny understanding of their struggle. He should understand. He was once an addict himself, addicted to amphetamines.
I'm in recovery. I've got 13 years clean.
Wow, congratulations.
Thank you. I've been there, and not only have I been there, every day I work at remembering what it was like when I was there.
Although his practice has been very lucrative and has made him famous, this doctor says it is not about money or glory.
I do think that this was the preferred method of getting off of opiates. If I was that patient on opiates, that's what I would do. If it had been one of my children, that's what I would choose to help them with.
In July 1998, Jan Kindig came to Dr. Guberman to help the man she loved. Her life, she says, had become a living hell once her fiancé Les, a successful businessman and vintage car collector, became a heroin addict.
I had lots of hope. I wanted my life back. I wanted the man I loved back.
As Dr. Guberman's associate injected rapid detox drugs into Les's body to initiate withdrawal, Jan thought her battle was almost won. As Les was resting comfortably in his hotel bed later that night, Jan dreamed of a new life. When she awoke the next morning, she expected her fiancé would be clean. Instead, he was dead.
I ran around the other side of the bed and touched him, and he was very cold.
The medical examiner later determined that Les had died around midnight, a little more than 8 hours after he was released from Dr. Guberman's clinic.
He said it was going to be the first day of the rest of his life, and it was the last.
To her horror, Jan Kindig would soon find out that her fiancé was not the first to die after Dr. Guberman's rapid detox, nor would he be the last.
Now, returning to our story, Dr. Lance Guberman earned celebrity status for his work with heroin addicts. His methods seemed to work when nothing else did, and to work quickly and far less painfully. But now a patient has died, and authorities say the doctor has been taking unacceptable risks. Once again, Dr. Bob Arnott.
I don't think these people are particularly knowledgeable at rapid opiate detoxification. I don't think anyone's ever seen one. I don't think they have nearly the experience in treating drug addiction as I do. and I think they're just speculating.
Dr. Lance Guberman is as defiant as ever. But why is a celebrated doctor a hero to thousands of drug addicts on the defensive? The state of New Jersey says his method of rapid detox was too rapid, leading to dozens of hospital emergencies and several deaths.
In providing a procedure known as rapid opiate detoxification, he did so in a dangerous fashion, and in a fashion that ultimately caused or contributed to the death of 7 people.
New Jersey prosecutor Douglas Harper wants to take away Dr. Guberman's medical license. He contends Dr. Guberman ran a one-size-fits-all practice, where standard preoperative physical exams were skipped in an effort to treat more and more addicts.
The screening mechanism was essentially nothing more than a taking of a brief history of the patient and some preliminary studies as well.
Furthermore, Harper says that Dr. Guberman is not an anesthesiologist and should not be allowed to supervise a procedure in which the patient is heavily sedated. But one of the most serious charges has nothing to do with the procedure, but what happens after it. A look at the list of the patients who died shows that all were released from the clinic within 3 hours of the procedure, and in one case after only 15 minutes. 5 of them went on to die in less than 19 hours.
The absence of an overnight stay or extended monitoring is a critical point in this case. There was virtually no control of the patients once they were discharged.
Remember Jan and Les? In fact, just 7 months before he came to Dr. Guberman, Les made it through a similar rapid detox procedure, which kept him under supervision for several days. But at Dr. Guberman's clinic, Les was discharged after only 2 hours, and Jan says she was suspicious.
This wasn't somebody that, if I hadn't been there, could have made it to his room by himself. I wouldn't have thought he should have left. He was just really drugged out. It's too soon. He just kept saying that all the time. It's too soon.
To release his patients to well-meaning but unqualified caretakers like Jan Kindig, instead of leaving them under the care of highly specialized doctors and nurses, was, according to prosecutor Harper, not only unprofessional, it was negligent.
The tragedy in this case is that medical crises arose, which these individuals were not trained or able to respond to.
There are lots of people, thousands every day in America, who have routine surgery as an outpatient procedure, and then, even though they've had general anesthesia, are packed off to go home on their own.
The procedure per se is still an evolving procedure where all of the scientific and medical ramifications are not known. Patient safety shouldn't be compromised to an extent where there's a direct danger to that individual's well-being and indeed life itself.
The main problem with that charge, says Dr. Guberman, is that nothing in his rapid detox procedure ever endangered his patients' lives.
I don't think there's any link between what we did here and the fact that these patients died several hours later.
Dr. Guberman claims that all 7 fatalities have one thing in common: an underlying cardiac condition caused by years of heroin and cocaine abuse that simply left them too weak to survive the rest of their withdrawal.
I think that these patients had an underlying condition that we couldn't detect, we wouldn't normally test for, and even if we did test for it, we wouldn't have been able to find it.
What do you say to critics who charge that you would let any patient undergo this procedure regardless of their medical history?
Well, that's simply not true. Pregnancy, of course, was an exclusion. Recent use of cocaine was an exclusion. Sometimes if they had a heart problem, we would get them cleared by a cardiologist. You see her eyes. She used today?
But Dr. Guberman admits that most of the time he relies on his patients' verbal answers, not on routine testing for pregnancy, cocaine, or heart problems. And he conducted no additional tests on the patients who died.
You don't have to like them.
Dr. Guberman says that rapid detox is no different from, for example, a tonsillectomy, plastic surgery, or dental surgery, during which a patient is placed under general anesthesia but still released to go home the same day. He says that everything that he does meets or exceeds accepted medical practices, and he says he's not required to be a board-certified anesthesiologist to supervise rapid detox procedures.
In this particular circumstance, I'm better than an anesthesiologist because it is what I do. These were not normal patients responding to drugs normally. These were drug addicts being put through a precipitated withdrawal. I have done more of these than anybody else in the world.
And he's just as firm when it comes to one of the key charges against him, that he released patients from his clinic much too early. In one case, just 15 minutes after rapid detox.
15 minutes. Was that really enough time for her to recover and leave under her own steam?
The patient met the criteria for discharge. I think it's wonderful that the patient, after being on large amounts of heroin, spends 4 hours here and is able to get up and walk around and feel good enough that she wanted to leave.
But then dies.
The patient had an underlying problem, and what she did after she left isn't known.
But experts for the prosecution argue that some after effect of this treatment is what eventually did these patients in. And if you had simply kept them overnight, you would have had a chance of saving some or all of them.
I guess the most compelling evidence of that is that there are other people doing rapid opiate detoxification and keeping the patient overnight, and they've still had deaths.
Dateline was able to confirm Dr. Guberman's contention that staying overnight at a hospital is not necessarily a guarantee that no fatality will occur. We learned of at least 3 cases where patients died in the hospital after undergoing rapid detox, one of them almost 3 days after the procedure. And Dr. Guberman says that even if you consider that 7 of his patients died, that would be less than a 0.5% death rate. Minuscule, he says, compared to the number of deaths that would have occurred had his patients continued to use heroin.
If you take 100 heroin addicts, 2 to 5 of them at the end of the year are going to be dead. We took 2,350 patients over 5 years and had 5 deaths within 48 hours of the procedure.
And there is one more thing. To Dr. Guberman, perhaps the most important part of his defense. He claims that in at least 2 cases, his patients contributed to their own deaths by using cocaine after their release from his clinic. It's a claim the prosecution vigorously denies. But although its experts all say that it is Dr. Guberman's rapid detox that contributed to the deaths they examined, in reports obtained by Dateline, they don't seem to agree on what exactly killed any of those patients. One expert sums it up this way: it is problematic how to connect the exact cause of death to an element in the treatment of these patients by Dr. Guberman.
If you can't prove the anesthesia killed them, and you can't prove that any of the drugs killed them, and they didn't take any heroin or cocaine or other illegal drugs that killed them, it doesn't seem you have any proof of cause of death that could be linked to Dr. Guberman.
On the contrary, where you have the deaths that are so imminent and proximate to the procedure itself, and where it appears the discharge was premature, an individual has, in our judgment, created a situation of danger which directly contributes to the death.
Prosecutor Harper argues that there's no objective data that back up Dr. Guberman's claims of success. Certainly none that shows that his rapid detox is more successful than traditional, and Harper says, less risky detoxification procedures, and that in this case, success does not make up for failures.
But we ran into patient after patient who legitimately said, gee, I tried the other stuff, it's so painful, I tried and I failed. I couldn't afford a procedure that was an in-hospital procedure. You know, I could afford the $2,500, I did it, I'm off the drugs, and I would have been dead without Dr. Guberman. What do you say to those patients?
I say to those patients basically this: we're happy that your drug treatment problem is under control. But understand one other thing. There are 7 people in this state who took the basic step to try to turn their lives around. And the tragedy of the case is they're no longer alive as a result of what happened in Dr. Guberman's office.
3 of these patients' relatives, including Jan Kindig, have brought wrongful death suits against Dr. Guberman. Meanwhile, after a hearing in September 1999, Dr. Guberman, without admitting any wrongdoing, agreed not to practice his rapid detox until a judge rules on the state's complaint against him. His trial is set to begin next week, The doctor says it's a battle he has to win. If not for himself, then for his patients.
Once you shut down your rapid detox operation, who do you think this affected the most?
The drug addicts that have died.
Died?
Yes. Drug addicts that could have been saved from the procedure. The drug addicts that are continuing to die.
Coming up 1 week from tonight, a special program on a new form of heroin that's having a devastating impact on some communities. It's more potent, cheaper, and doesn't have to be injected. America's new heroin epidemics, next Sunday on MSNBC.